All right, so we should be good. Let me pull up the presentation. Okay, so here we are. We are the Area Agency on Aging of Western Michigan, the source for seniors. We're located here in Grand Rapids. You can see our address and phone number right there on that first slide. I wanted to start with a little bit of history. So we were created in 1974 as part of the Older Americans Act with the mission of creating home and community-based services to maximize the independence and the dignity of older adults. We are nationwide. We were created by Congress to be a one-stop shop with information about programs, services, and housing options. Our mission is to provide older adults and adults living with a disability an array of services designed to promote independence and dignity in their homes and in their communities. And then funding. We are a 501c3 nonprofit organization, and our services are funded through the Michigan Department of Health and Human Services, through the Michigan Aging and Adult Services Agency, and the Kent County Senior Millage. And we will actually touch on those in a little bit as well. So we'll come right back to it. So like I said in a previous slide here, we are nationwide. Our individual branch here, the Western Michigan branch, covers 9 counties, which you'll see on this map are Allegan, Ionia, Kent, Lake Mason, Mecosta, Montcalm, Newaygo, and Osceola. Michigan actually has 16 area agencies, which is quite a bit compared to other states. We're super lucky in that way. So every county in Michigan is actually serviced by an area agency. It might not be us, but it might be another one. So if you have someone in mind in another county that we don't cover who could benefit from anything we talk about today, we can certainly get you connected with the area agency in that county and get you connected with services there. Now I will pass it off to Zakia, who runs our information and assistance. And remember, you are muted, Kia.
Yes, thank you for the reminder. Good morning. It's good to have a little sunshine this morning, so I'm enjoying that. And yes, I am Zakia Ambrose, the Access Coordinator Supervisor. I've been with the area agency for 13 years. And so our department, Information and Assistance, we are also referred to as the Intake Department, which Carly maybe has already said, which is totally fine, because that's something that's been out there in the community and we just want people to call us. So quite often we are getting our calls from our lovely reception staff. They are taking kind of those first calls to answer questions, and then they'll triage the calls to us where people kind of have more questions, they need more assistance, they're looking for programs for themselves or a loved one. We get calls from professionals, doctors' offices, nurses, social workers in the community. We definitely get calls through Carly's outreach in the community. And so what we're able to do is, meet someone where they are and talk about kind of what the situation is, or a lot of people also are looking into planning for the future. And it's really kind of having that first conversation with people, or the second one, because people are having to sometimes kind of make that second call to several different organizations. But we like to be where once they get to us, we can kind of listen to their situation, see how we can assist. So we're able to talk about the programs we have in-house that are available, and then we're also able to talk about things that we can refer you on to, such as programs through the Veterans Administration, or if you're needing home delivered meals, if you're looking into other services in your home, you need a personal emergency response button, just a variety of programs and services. So we have myself and 3 full-time access coordinators that would get your call. We try to be able to answer most of our calls right away and have people not go to voicemail, depending on the call volumes. We appreciate being able to do that and get the information. We try to take the time with people and see what they're looking for, and is person-centered around what services and care needs that you're interested in. So I like that this slide is just a phone number, because that's the main thing for our department, is giving us a call, letting us kind of talk it through with you and see how we can provide assistance.
Thank you, Kia. And next we have, oops, let me hit the slide. Next we have Martha, who's our eligibility supervisor in the care management department.
Hi, everybody. We're glad to have you here this morning. As Carly indicated, I'm the eligibility manager here at Area Agency on Aging, and I oversee the Community Transition Services program. For those of you who are professionals who may make referrals to our programs, the Community Transition Services was formerly known as the Nursing Facility Transition Program. We had a name change within the last year, so this is what that program is. To be eligible for community transition services, an individual has to be eligible for Medicaid, reside in a nursing facility, have a desire to return to the community, and be facing barriers in order to have that move take place. Do you want to go on to the next slide, Carly? Thank you. The Community Transition Services offers an assessment completed with the individual who's residing in the nursing home and their family or supports to determine what barriers they have to returning to the community. Common barriers might be things such as a need for new independent housing, a need for placement in a more supportive setting, need for a ramp or another home modification of some kind, or need for for care at home if they were to discharge back to the community. Referrals are made on their behalf to meet those needs by the what we call transition navigators. So the person completing the assessment is called a transition navigator, and they would be helping to coordinate those services and needs to meet the needs that the individual has. The transition program has funds available to address certain barriers by the program itself. One such area is we do have a housing specialist on staff who, for our transition clients, she can help complete housing applications and connect individuals with affordable subsidized housing. Next slide, thank you. So the timeframes for the community transition services. We would encourage individuals to make a referral as soon as there is a need identified, or even if there's uncertainty. So if somebody is in a nursing home and they know that they want to go home, but there's uncertainty as to whether or not they're going to be able to do that, or if they're going to face barriers upon their discharge, the earlier you can get that referral in, the better. Once we have a referral, we have 2 weeks to assess that individual. But then once we do that assessment and we identify the barriers, it does take time to coordinate services and arrange for care in the community, or arrange to have the barriers that individual faces be met. One area that can take a longer period of time is housing, especially when we talk about somebody who needs new, independent, affordable, accessible housing. You know, for older adults, that might take, you know, anywhere from 6 months to a year, depending on what county they're in or what geographical area they're in. And then for individuals who are younger disabled, that can have even longer timeframes beyond that. And so the earlier that we can start that process, the better. Another area that can sometimes expand those timeframes is if somebody doesn't have identification, social security cards, photo ID, our housing specialist can assist them in obtaining those documents, but oftentimes we're not even able to start the housing application process until they have those documents. So again, just as soon as we know that there's a barrier for somebody to return to the community, getting that referral process started is a good idea. Community Transition Services also offers follow along and support. So once that individual has discharged out to the community, the transition navigator remains involved throughout the process. They collaborate with both the informal supports, the family members, the friends that are involved with that person's care, and nursing home staff to make sure that discharge planning, so the person has everything that they need the day that they return to the community. We also want to ensure that the plan is followed through on. So we're coordinating to make sure that if equipment device is ordered for that person, follow through with the durable medical equipment provider to make sure that it's actually delivered to that person when they discharge. The transition navigator also has continued involvement for up to 30 days post-discharge, so continuing to touch base and check in with that person after their discharge to make sure that all of the services that they thought they were going to be receiving are in place and that things are going as well as they possibly can. An individual might have other supportive programs in place after discharge, and those would be ongoing. The majority of the clients that we do serve through the community transition program, once they discharge, enroll into one of our other programs at Area Agency on Aging. And so there then would be a care manager who would be involved with that person to provide and coordinate those services ongoing. But the transition navigator's role through the community transition services is just to help with that planning for discharge and coordinating to make sure that all of those supports are in place and going well. And then at that point, they would close while the other programs would continue. So if you find yourself in a situation where you are in a nursing home and you're concerned about trying to be able to get back to the community, or you have a client or a family member or a loved one who's in this situation, we would encourage you to call our intake and talk about community transition services. Thank you.
Thank you, Martha. Up next, I'm going to be talking quick about the community options counseling, and then we'll get to the choices for independence. So they're very similar programs, which is why I always kind of pair them together. But community options counseling is a one-time visit to discuss resources in the community. So a social worker will come out to a nursing facility and speak with those who are expressing a desire to explore options. I'm actually the social worker behind this program, so I would be the one to come out and, again, just kind of talk about what's available out there. So it's a very no pressure meeting. It isn't necessarily if you're wanting to discharge, if it's something that you're wanting to explore, that's really kind of what this program is for. So we'll talk about what's available in the community. A lot of times I see people who are wanting to discharge and they just don't know what that would look like or what it could look like. So we sometimes see people who know that it wouldn't be safe if they just discharged and went home. So they're wanting to know what programs are out there to keep them in their house safely, and what could that look like. So just kind of an educational visit. I'm happy to usually leave a list of resources that we talk about, or kind of connect families with other resources like that. And then choices for independence, like I said, is quite similar. This is sort of a program for people not in a nursing facility. You do have to be 60 or older to qualify for this program, but it's really just, again, wanting to talk about what resources are available. So I'm happy to make referrals and kind of walk people to the next step, but a lot of times it is, like I have mentioned, just an educational visit on what resources are available. It's really that broad. It can be people who are kind of in a crisis mode, or it can be people who are looking for years down the road when things are not as independent as they are now. So wide variety, and it can cover a lot of different things. So next, we will be talking about our care management programs, and I'm going to pass it off to Stephanie, who is the, I'm blanking on your title, access manager, my own boss. Stephanie, take it away.
Well, hello, good morning. So I am Stephanie Hexel. Like Carly said, I'm our access manager at our agency, and I am hoping for a good 10 minutes here because I just got booted out of here saying I had bad internet connection. So if I run into any problems, I'll keep my eye on the chat and make sure that I'm connected still. But I'm going to talk for a little bit about some of our in-home care options. I know we're saving questions until the end, but I also took a peek at the chat and saw somebody ask a question about what kind of services are out there for somebody that wants to stay in their own home. That's the setting they are in now, but maybe it's becoming more difficult for them. So that leads us into some of the in-home care programs that we offer at Area Agency on Aging. So the first one is care management, and we do offer this type of service in all 9 of the counties that we serve. We get 2 different funding sources for this. So we do get funding from the Kent County Senior Millage for those that reside in Kent. And we also get funding from the Older Americans Act. It's a federal source of money, and that does help provide and cover these services in all 9 of our counties. So who qualifies? What does this program actually look like? We serve individuals who are in an independent setting who are age 60 and up. When I say independent setting, what I mean is their own home or apartment, maybe even the home of a loved one, but this is going to be for somebody not in a facility. So not assisted living, not nursing home, but somebody in their own independent housing situation. There are some asset limitations in place in order for us to purchase the in-home services that would be provided. Just for presentation's sake, I'll let you know what those are. For individuals who are not married, we would see that they would be below $35,000 in assets. For individuals who are married, that limit goes up to $45,000. That does not include their home or their vehicle, but it's really savings, checkings, retirement accounts, things like that, we would want to make sure they're under that threshold in order for our services to be involved and financially covered. And then with this program, for those that are in Kent County and using that Kent County Senior Millage Funded program, there may be a cost share people are asked to contribute towards. This is all based on their own unique income and what kinds of care they are receiving and to what level they are receiving it. Now I say all this because these are the qualifications, these are the behind the scenes, but this is not information that people would necessarily know without talking to our agency first. So as you've already heard in this presentation, my one thing that I tell everybody is if you're thinking you need help or you know somebody that maybe is starting to need a little more assistance and they are wanting to stay at home, wanting to stay as independent as possible, call our agency, call proactively if you're trying to figure out what's available to them and want to get this process and this conversation started. Because at that time, that's where we're going to go through some of the questions over the phone, as Zykia mentioned earlier, to help determine if somebody could qualify for these services we offer. But getting into what does care management actually look like, this is a long-term option for individuals. And so what we can see, or what we do is when somebody calls, we go through our pre-screening, determine what kinds of needs there are. And really what we are looking for is some sort of unmet need that this program will fulfill on a long-term basis. So you can see on this slide some of the different options that can be provided. It could be housekeeping, personal care, respite care, or a combination of those, plus supports coordination from care managers from our staff. Now, something to be mindful of is we oftentimes do have a wait list for this program. And so if somebody is thinking, well, I could use this help and I should probably start considering this, I would say now is the time to call then. We have the one phone number for everything. So it is just a call to our agency. That will get you into our intake department where we will then have conversation about what those needs are and what types of services could be provided. And then that also is what could potentially get somebody added to the wait list. When an individual's name comes up, we would contact them again, make sure they still want the services and that they're ready to go. And then once they say, yep, that sounds great, would love to have some help at home, we would have a nurse and social work team assess them and actually coordinate this in-home care for them. One thing to know is that Area Agency on Aging, we are not the actual in-home care providers. We function as the supports coordinators. So we have a partner of agencies, a partner list of agencies that we work with who actually have their caregivers go into the home and provide the personal care, housekeeping, or respite care that's being requested. Our job is to oversee that, to make sure that that's going well, and to help with any other resource connecting or assistance that somebody might need in the duration of our care. And as I mentioned before, this program is long-term. So it is meant to help somebody indefinitely. As long as they qualify, they need the help, these services are working for them, we can be involved with somebody for years. But the goal of this, again, is just to help fill in that little bit of unmet need so that that person gets what they need to be able to stay in the setting that they want to be in, which oftentimes is their home. So great for individuals. I know there's a lot of agencies out there that provide private duty care, which is wonderful because people still have the option to get care at home, but that can be very costly. A lot of agencies are charging close to $25 an hour. So to be able to have a funded option like care management that can provide routine oftentimes weekly care to help somebody stay at home as long as possible is really a great benefit and is all about promoting that independence that we support for individuals. And next slide. The other care program that we offer is My Choice Medicaid Waiver. I will say we have a limited amount of time today, and this program in and of itself can be its own hour-and-a-half long presentation. And even after that, we probably still wouldn't get through all the details. There's just a lot to it, and it's a big program, but it's also a very wonderful program, again, about promoting that independence. So what is My Choice Medicaid Waiver? It is a long-term option, just like care management, but it's for individuals who could actually qualify to reside in a nursing home for long-term care. It's for high care need individuals who really could be in a nursing home for the duration of their lives, but what they would prefer is to be in the community, to be in their own home setting, or sometimes even in assisted living, which is a little less restrictive, and to live there as long as possible without having to go to the nursing facility if that's not their choice, but to still have their service needs met. And so My Choice Medicaid Waiver, there are some qualifications, as you can see here. We do serve individuals in this program. They would either be age 65 and up, or they could qualify if they're between ages 18 to 64 and are certified disabled. So I know at the beginning you heard our mission of who we serve, and that includes individuals with disabilities. So although we're Area Agency on Aging, we do see younger individuals and are able to provide services to them too. The other part of this program is that somebody would have to be eligible for long-term care Medicaid. There's Medicare insurance, there's Medicaid insurance, there's My Choice Medicaid Waiver. This gets very confusing for individuals. Even this line alone that says eligible for long-term care Medicaid, what does that mean? When somebody calls our agency and they may or may not be looking at some programs like this, but they're identifying, I need some help, we are always going to go through a pre-screening over the phone to figure out what it is that they might qualify for. And that pre-screening is questioning about what their day-to-day needs are, as well as their financial situation, so that we can help, one, educate on what long-term care Medicaid is, and two, identify if this is something that somebody would qualify for. There's like 30 different types of Medicaid programs in Michigan. This is one of them. So this can get really confusing, and we don't want that to be the experience for people. So again, I'm going to default to call us and we'll go through more details of what long-term care Medicaid is. There is a monthly income limit for an individual to be eligible. So that amount you can see on this slide is $2,382 per month, and that is a gross amount. So we do have to make sure that a person's income is below that. That's just the limit, though. There is no cost to being in this program. I mentioned already that people would, in this program, would have high care needs. They would be people that technically qualify to be in the nursing home to receive services there, but we're providing services outside of that setting. A lot of people don't necessarily know offhand, what does nursing home level of care mean? Again, as you call our agency, we're going to go through some questions that are a lot simpler than that. We are going to ask about your daily life. How are you doing your laundry? How are you getting your groceries? How are you getting your needs taken care of at home? And those answers will indicate if somebody may be eligible for this program. And then the other criteria for this is have an ongoing need for services. So again, it's a long-term care program, and we want to make sure that somebody in My Choice Medicaid Waiver will have a need for the services that we can provide on an ongoing basis. I know we were supposed to save questions till the end, but I did see one come through and I'm on the slide, so I'm going to go for it. So the income limit for this program, just to clarify, as you see here, it's the $2,382. That is the income for the individual that is going to receive the care. So even if a person is married, but it's the wife who needs the care, when we consider income, we're looking at just the wife's income, even though the husband may also have Social Security and a pension or things like that. That's what we consider for this program. And again, all of that would be reviewed during the pre-screening to help somebody understand if they might be eligible for this type of program. So then the next slide highlights briefly what the services are. And so with My Choice Medicaid Waiver, this is a program that can provide a high amount of care at home. This can be oftentimes daily care. As you can see here, there's a whole variety of things that we can offer, but most commonly what we see is individuals who have a caregiver that helps them get up and get ready for the day, get dressed, do their morning hygiene routine, help make breakfast, remind them to take their medications, throw in a load of laundry, do some other housekeeping tasks around the house, all the day-to-day stuff that we need as individuals to live well at home. These are the types of things that My Choice Medicaid Waiver can provide to somebody who is physically or maybe even cognitively unable to do this themselves. There's not necessarily one set package deal of what you get with My Choice Medicaid Waiver because it is person-centered, and we develop what we call person-centered service plans based on everybody's unique care situations. So when you are working with our agency and you're being assessed by a nurse and social work team to get into this program, the other part of it too is we're looking at what a person's situation looks like, what those unmet needs are, and how we can utilize these types of services to help fill in those gaps, and again, maintain the goal of keeping somebody in their own home setting. Again, I could go into a ton more detail. This could be a whole separate thing, talking about what this looks like and what we do and how we continue to stay involved. But the one thing I would want people to remember is, again, this is a long-term option. Our nurses and social workers, our care managers who help people continuously make sure they have what they need so that their home situation is successful. And we continue to provide that support. So again, they live as independently as possible with a program like this.
All right, thank you, Stephanie. And thank you for answering that question. I was gonna tell you too if you didn't, so I appreciate that.
Absolutely.
We're gonna shift a little bit. Those were kind of our care management, our in-home programs. We're gonna shift over more to kind of our professional groups and some of our other groups that we do that you may be aware of, you may not be aware of, but just wanted to address the shift there. So Ann Ellermans is gonna take it over from here. She is our Director of Contract Services and Program Development.
Good morning, everyone. So take a deep breath. We've been sharing a lot of information and we're going to keep doing it for another hour, but please know that you will be able to contact each of us and get a lot more information and go through our information assistance department. So this is just to kind of whet your appetite, let you know what we have, and then we look forward to following up with you a lot more. So I'm going to talk a little bit about the Kent County Senior Millage. Hopefully everyone on this call has heard of it. It first passed in 1998, and we have administered the funding from the very beginning. The current millage is $0.5 mil for 8 years, and we're going to be up for renewal in 2022. So you'll definitely be hearing more about it next year for sure. In 2021, there's more than $12 million in service funding. There's a lot of services here in Kent County through the millage. We know that older adults have different needs to stay in their homes. And through the Kent County Senior Millage, we contract with 34 partner agencies for full contracts, and we provide 56 unique services to help older adults. We also have, through the Care Management Millage Funded Program, a lot of purchase of service agreements with agencies to directly provide the services in the home. At least half of the funding goes to priority services, which includes meals and transportation, adult day, in-home and outreach and assistance. So on staff, we have contract administrators who manage the contracts, providing oversight, technical assistance, and collaborating with our partners and the community to develop new programming. We also work with the Kent County Senior Millage Review Committee to determine annual funding, allocations, and review proposals for the new services. In order to receive services, you need to live in Kent County. It's very simple, live in Kent County and be 60+ years of age or older. Some of the services do require clients to contribute towards the cost, and that would be determined when you're accessing the services. To give you an idea of the number of clients served, The unduplicated count from 2019 was almost 24,000 clients, and we expect the same, if not more, for 2020. If you are not familiar with all the services that the millage offers, I encourage you to do that on our website. You can find the services directory. You can also contact our information and assistance department and find out specifically about some of the other services, such as dental, vision, hearing, legal assistance, home chore, and a whole variety. So encourage you to look more into that. The next slide is very specific about a service that we developed during the pandemic, called it the COVID-19 Senior Support. So when this pandemic started almost a year ago, in collaboration with our millage service partners, we developed a new service and got it going. Many of the millage services went on pause back in the beginning. The going into the homes, the meal sites, the congregate settings such as adult days were put on pause. And so this service was designed to help older adults get the essential services that they still needed. And also, as part of the senior support service, a client can get wellness checks through phone calls. So as an increasing number of older adults are starting to get the vaccinations, most services are available. We are still providing this service because it's still a viable option for a lot of older adults. You can call us at 456-5664 to get connected to this service. And just a comment about our service partners, we've always worked really well together as a network. And during this pandemic, they have truly stepped up in this challenging time, and we are so grateful for them. So the next slide talks specifically about Older Americans Act. So at the beginning of this webinar, Carly talked a little bit about the network of the AAAs. That's what we refer to them as, the Area Agencies on Aging. And in Michigan, there's 16 of them. So the AAAs were originally designed to develop programs throughout the areas that they covered and fund those services through the Federal Older Americans Act and the state Michiganian dollars. So in our area, we've been going strong for 47 plus years. We've been doing this for quite a while. Through Older Americans Act, we fund 29 partners throughout our 9-county region. And in FY21, we've allocated more than $7.5 million, about half federal and a half state. This past year, 2020, we served more than 14,000 clients. The services are the meals, transportation, a lot of caregiver support programs, adult day, grandparents raising grandchildren support groups, so a whole variety. As with the millage, we also have our contract administrators who manage these contracts, providing oversight, technical assistance, and collaborating on a lot of community efforts and developing more programs. In FY20, we received significant funds through the CARES Act and the Family First Coronavirus Response Act. That allowed us to provide a lot of additional meals, like an additional almost 300,000 meals in our region, along with the more than 900,000 meals that was part of our regular funding. We were able to also help our partners get a lot of that personal protection equipment, that PPE that was so difficult to come by, and we are continuing that in FY21. A big help was an advocacy push. Many of you may have heard about it at federal and state level to offer our direct care worker hazard pay of an additional $2 an hour for in-home workers and adult day program staff. And that's been really a huge encouragement to our frontline workers. So the last slide that I'm going to talk about is our long-term care ombudsman program. So the ombudsman program is one of the services that's offered directly by our agency. The long-term care ombudsman program is in every state, and we have 2 ombudsman staff out of our office that cover our 9 counties. So they have not been able to visit in the home since March, and instead are working with families by phone. They've been taking a lot of calls on how to help families arrange the compassionate care visits and addressing issues in the facilities, some of it arising from shortages in staff. So many families did take their family members home during the COVID. They were able to retain their spot in the facility. On the slide there, you can see a website for the Michigan Long-Term Care Ombudsman Program. There are great resources on there on all sorts of things related to long-term care facilities. We also have on our own website, we have a section on the Ombudsman program, so you can access our website too to get more information. If you're looking for information on choosing long-term care, that's something that our Ombudsman can work with. So we're hearing many residents and staff of the facilities are getting vaccinated, and hopefully it won't be long before family and friends will be able to get back in the facilities and visit, and our Ombudsman will be able to get back into the facilities as well.
And then we have the Elder Abuse Coalition with Cassie Capel, who is a contract administrator with us.
Hello and good morning. As Carly said, my name is Cassie. I am one of the contract administrators that oversees some of our contracts under the Older Americans Act and Kent County Senior Millage. In addition, I coordinate our Kent County Elder Abuse Coalition, which our mission is working together to identify, advocate, educate, and seek justice for vulnerable adult abuse in our community. So we are a group of professionals. We have over 40 agencies represented on our coalition that has a variety of backgrounds, as you can see. And we meet monthly to stay updated on what's going on with elder abuse. We talk a lot about different scams and resources available to our seniors to keep them protected. We also discuss different elder abuse cases that are going on in our community and really collaborate to make sure people are getting the help that they need. We also have a website, protectkentseniors.org, where you can find lots more information about elder abuse related articles. I post notices for trending scams, which, as you can imagine, the pandemic brought even more scams to our community and especially our seniors being targeted. So I encourage you to check out our website of all the information that we have on there. On our next slide, you'll see our brochure, which again has a lot of information about the coalition, and you do have a copy of this in your packet today. So just a few things to highlight. We do provide outreach presentations. So if your agency, if your staff need training, or if your small group just wants more information on elder abuse, we do provide tailored presentation. A few of our most popular topics for presentations is Elder Abuse 101. What is it? What are the warning signs? What can you do and how to report? Again, talking about our scams. There's been lots of new scams going on, so staying up to date on what to be looking out for. And then also talking about caregivers and elder abuse, about the support caregivers can get, talking about burnout, especially with the pandemic. There may be more responsibility put on people suddenly. So a variety of topics that we can talk about to your small group or agency, and you can find more information on those presentations and schedule that at our website or by calling the main number for Area Agency on Aging that has been talked a lot about during this presentation. I do want to highlight, though, there's lots of great information, and we're here if you need to consult on a case. If you do have concerns for elder abuse or neglect, I want to direct you to call Adult Protective Services to make that report. And that number is on the brochure here. It's 855-444-3911. So whether you just have a little bit of information and concerns or you have an extensive story, I really encourage you to call that Adult Protective Services number to make that formal report. But again, you can look at our brochure for more information, go to our website, or call the agency for more information, and we'd be happy to talk to you more. Thank you.
Thank you, Cassie. Sorry, I flipped the slide on you on accident there. But next up, we have Sarah Sobel. She's another contract administrator with us who runs the Caregiver Resource Network. If you want to take it away, Sarah.
Yes, and unfortunately, this is when I have a home phone and it just randomly started calling. So hopefully I have my cell phone on mute. So hopefully that doesn't happen. But I run the Caregiver Resource Network. And as much as you've heard us care for the clients of the Area Agency on Aging, we are also caring for the caregivers. And hold on, I'm going to just mute this. I'm sorry, I was calling to ask for money. So, so as much as caregivers, we care for the clients, we are also caring for the caregivers at the Caregiver Resource Network. And so through that, we have a collaboration of 100 organizations that seek to provide education and other resources for the caregivers. We do this through bi-monthly meetings of just talking about different topics, such as, you know, what is the PACE program? What are animal support? All other different programs. So we do that through the Caregiver Resource Network. Family Caregiver University came out of this program of the Caregiver Resource Network as well. That is a once-a-month educational class for caregivers where we focus again on issues that caregivers are facing. We often say if we are going to, you know, support and leave the clients in their home, we also, if that's their goal of staying in their home as they age, we also need to support the caregivers so that the caregivers can feel supported. Something that also came out of these two groups of the Family Caregiver University is we are also running a once-a-month family caregiver support group on Tuesday mornings. If you would like information, you can get a hold of me of that. That's just for family caregivers in the area. And then Diversity Academy, we are focusing on issues of diversity, how we can best support people in the area of diversity and educate the caregivers and also educate the family caregivers, but then also the paid caregivers in the community as well.
All right, thank you, Sarah. Up next, we have Kendrick, who's another contract administrator, talking about transportation resources.
Good morning, everyone. I'm Kendrick Heinlein. I oversee our RideLink program, which is a transportation system for older adults, 60 and older, to go to various destinations throughout Kent County. To qualify for RideLink, you do have to be 60 and older and live within Kent County. The providers that make up RideLink are Hope Network, Kent County Community Action, The Rapid, Senior Neighbors, and United Methodist Community House. RideLink, because it does receive the supplemental funding from the Kent County Senior Millage, there is just a suggested $2 donation each way. We'll never turn you away if you can't make that full donation, but we do ask that you give what you're able to on that day. We like to always highlight that those donations go directly back into the program to help provide rides for more older adults. RideLink partners pride themselves on being able to provide a multitude of destinations for transportation. Not only is it medical, but we can take you on shopping trips, recreational visits, if you'd like to see a friend. So don't feel that RideLink, there's a lot of transportation systems out there that are just for medical appointments. RideLink is not one of those. I'd also like to highlight that we are available for, if you so choose, for vaccine clinic transportation. RideLink partners are working with the Kent County Health Department to set up rides for the vaccine clinics. So if that's something that you are interested in, feel free to contact RideLink and we'd be happy to help you with a ride on that day of the vaccine. To register, so you have a couple options to register for RideLink. You can either go to the websites you see here at ridelinkKent.org or ridetherapid.org and fill out an online registration to use the service. If you'd prefer to have one mailed to you, you can call the RideLink office at 616-774-1288, and they will mail you a paper registration, which you will need to fill out and send back to the office for you to be able to get your ride. I will say that it takes about 5 business days to get registered. So if RideLink is something that you see yourself using for the year, I would register now just to make sure that you are on file and able to use that ride when you need it. Registration is revised each year, but if you use the service throughout the year, you will not continuously need to re-register. They will just update your information for year to year. You can call and schedule a ride 7 days in advance for RideLink. I would suggest you do so, because the earlier you can schedule your ride, the greatly it increases your likelihood of getting that trip and be able to get to the destination that you're looking to do. It's a very popular service, as I'm sure you're probably all well aware. Transportation is always a great need throughout Kent County. So the sooner you can register and schedule your ride, the sooner you are able to get that ride and guarantee that you get to where you need to go. Thank you.
Thank you, Kendrick. And then up next, we have Stacy Gerken, who's another contract administrator with us.
Good morning, everyone. My name is Stacy Gherkin, like Carly just said, and I am a registered dietitian, and I primarily work with the home delivered meal programs, which you've probably heard called more frequently Meals on Wheels and congregate meal programs throughout our 9 counties. I do also teach some cooking classes, which is what I'm going to talk about today. They're not currently operating because of the pandemic, but we are so hopeful that once we are allowed to have in-person meetings again, that these will be back up and running. So Conquering the Kitchen is a 4-week cooking class, and it's really designed specifically for older adults. So we talk about meal planning, staying on a budget, using leftovers, cooking for 1 to 2 people in the household, so smaller quantities. There is a meat and potatoes version, and we also have a vegetarian version now, so it just depends on which one speaks to you a little bit more. They are offered 1 to 2 times a year, and we keep the class size really small so that you have a lot of interaction with the other participants and with me, and I have a lot of hands-on time. So we learn a little bit, we cook lunch, and then we eat it together, and it is a lot of fun. There is a small charge, usually between $30 to $40 to cover the class materials. So if you're ever interested in these, you can reach out to me, or you can call our intake department and they can get you connected to me as well. So thank you.
Thank you, Stacy. And then we have Jillian Ahumada with our Healthy Aging classes.
Hello, everyone. My name is Jillian, and I'm the coordinator of Eaglecrest Healthy Aging. Our mission here is to keep the people in our community active and independent. And how we go about that is by offering classes to help keep our bodies strong. We help to keep that endurance going, right? So our classes are either physical, we also work on mental health, and we have a few, which I just popped in at the end of Stacy, that have to do with nutrition and healthy eating. And so one thing I want to mention is that all of our classes are geared towards older adults age 60 and over. So you're going to be working out. Let me just say that healthy aging classes are exercise based, and you're going to be working out with a class of your peers. All of our classes are designed to help with our balance, strengthen our muscles, improve our flexibility, and also kind of change the way we think and change the way we feel and view exercise, excuse me. And so the programs that we offer here are cardio based to get that heart rate going and to help keep that endurance up. Tai Chi is a class that really helps with mental clarity. It helps strengthen the muscles for balance. We also have a Matter of Balance class, which is actually a workshop designed to keep those muscles strong and learn how to prevent falls through changing the way we think and view falls. And it's called Changing Our Stinking Thinking. I feel like I'm talking really fast because I have a lot to cover in a short amount of time, but I want to talk to you also if you're ever interested in becoming more flexible. Our yoga classes are fantastic. All of our classes are taught by certified instructors who've worked with older adults and are able to modify all of the movements that we do. So our goal here is to have you start becoming active where you're at. You don't compare yourself to other people. You join us where you're at, and we modify everything so that you're able to stick with us and grow with us. Another thing Healthy Aging has done is created a community, which is really important during this pandemic. It helps to keep us communicating. It helps to keep us together as a group, and kind of, again, takes away some of that loneliness and that isolation. Really cool what we've got coming up in the fall is, in the spring is a new class called Active Living Every Day. And this class is good for us because through the pandemic, I mean, a lot of people, including ourselves, motivation has kind of gone down with exercising. And so we want to get you back going, get used to Zoom, get comfortable. And Active Living Every Day is really a goal oriented program that's going to help us create goals in order to blast through any barriers that we have to stay active and actually start becoming active. We are a Silver and Fit and Silver Sneakers facility. So that means if you hold that benefit of your insurance, that benefit could possibly pay for your classes here. If not, we offer very low cost to attend our classes. So thank you all so much. If you have any questions, please feel free to connect.
Thank you, Jillian. Yes, lots of exciting things going on. hope you guys are able to keep up with all of this information. We are nearing the end. We just have, well, we still have 3 more presenters. Up next is Bob Callery. He is our MAP coordinator.
Good morning, everybody. Again, my name is Bob Callery. I'm the regional coordinator for our MAP program here with Area Agency on Aging. MAP is the Michigan Medicare Medicaid Assistance Program. We are a statewide volunteer organization that helps to provide free and unbiased help answering Medicare questions. So we help answer questions for the whole spectrum of Medicare, all the way from new to Medicare to yearly plan reviews during open enrollment and everything in between. We do have volunteers throughout all 9 of our counties. So we do have a centralized 1-800 number, and you'll notice that on the slide. So you call that number and it will direct you to a local counselor within your county. Just to highlight a couple of the items on the list here, primary purpose for our program is lots of education. So helping people understand their benefits so they can make solid choices on what insurance companies or what plans to choose for their coverage. We do lots of plan reviews, so prescription plans and Medicare Advantage plans, both at initial enrollment time, the yearly annual open enrollment in the fall, and then if somebody qualifies for some type of special enrollment, if they move, go in and out of a nursing facility, qualify for one of the low income assistance programs, our volunteers can help review plans for those individuals. We also help with applications for the low income assistance programs. The 2 primary programs that we help with, one is Medicaid. The primary program with Medicaid that we help with is called the Medicare Savings Program. That program focuses on paying the Medicare Part B premium that's deducted out of Social Security check each month. So our volunteers help with applications, help people fill those out, identify what documents to turn in to the state of Michigan, and with any yearly redeterminations that may need to be done. The second primary assistance program we help with is called Extra Help. That is a Social Security program that focuses on reducing or eliminating monthly plan premiums, deductibles, and copays for prescription coverage. So we help do those applications on the Social Security website and answer any questions with that. Plus, we play an important role with Medicare fraud and abuse education. So lots of scams continually going on. The estimate, anywhere between $60 to $70 billion a year lost in Medicare fraud and abuse. So we help identify any scams that are going on so people can be aware of these scams and to look out for them so they do not become victims of any of those fraudulent activities that are going on out there. Carly, back to you.
Yeah, thank you, Bob. Up next is Lacey Charbonneau, and she has lots of hats. So Lacey, I will let you introduce yourself.
Hi, everyone. I'm Lacey Charbonneau. I'm the Planner, Advocacy Coordinator, and Dementia Friends Program Coordinator here at the AAA. First, I'm going to talk to you about the Advocates for Senior Issues, which was originally founded in 1982 as the Senior Citizen Senate. Now known as the Advocates for Senior Issues. It's a nonpartisan group empowering seniors through advocacy and education. The advocates are based in Kent County and focus most of their advocacy around issues relevant to older adults in Kent County or surrounding counties in West Michigan. The advocates are a volunteer-run organization with staff support provided by me. The group meets once per month on the 3rd Friday, beginning at 10 a.m. Meetings typically begin with a state senator or representative answering questions that were predetermined by our legislative committee. Following the legislative portion of the meeting is a program that focuses on an area of interest to seniors. Topics are varied and have included housing, climate change, advanced directives, Medicare, older adult learning programs, advocacy training, racism, and election recaps, just to name a few. Advocates meetings are currently completely free and open to the public. In addition to the awesome programs, the advocates also write letters, contact legislators, and visit Lansing to meet with legislators and advocate for older adults. Typically, the Advocates is a paid membership group. However, membership fees are waived until we can meet in person again. Meetings in the past were primarily held at Frederick Meyer Gardens. When we return to meeting in person, we anticipate resuming meetings at the Salvation Army Kroc Center in Grand Rapids. If you're interested in learning more, attending a meeting, you can reach out to me, or you can check out the Advocacy tab on the Area Agency on Aging's website. Then moving on to the next slide, I'm going to talk about the Dementia Friends program. Dementia Friends is a social action movement that aims to improve society's understanding of dementia. The goal of this program is to help everyone in a community understand 5 key messages about dementia, how it affects people, and how each of us can make a difference for people living with dementia. So the 5 key messages are that dementia is not a natural part of aging. It is caused by diseases of the brain. It's not just about memory loss. It's possible to live well with dementia, and there's more to a person than the dementia. This program is available to anyone or any group within our 9-county region who would like to participate. The program is 1 hour long. However, we are planning for 90 minutes now that we're virtual. It's important, as we believe it's crucial, that people with dementia are understood and supported in the community. Each and every one of us can reduce isolation and help people living with dementia feel welcomed and included. If you or your organization or your church or social group are interested in learning more or would like to schedule a session, please reach out. Our dementia champions are ready to offer individualized training to any group or organization. We also offer a recurring Dementia Friends session on the last Thursday of the month, beginning at 9:30, and those are all offered via Zoom. Anyone and everyone is welcome and encouraged to attend. Thank you.
Thank you, Lacey. And then our last speaker is Emily Armstrong. She is our communications coordinator and public relations.
Yes, good morning, everybody. So mine is pretty short and sweet. Obviously, in my position, I want to make sure that people know about all these resources that everyone covered today. We obviously have a lot out there to support older adults and their caregivers. So I just encourage you 2 things is 1, we now have an email newsletter. So if you want to stay up to date on virtual events, I know we mentioned that a lot of our events are virtual right now. The newsletter will include the upcoming dates for those. It usually has an article that pertains to older adult or caregiver issues. There's a section on there, as Cassie Capel mentioned, lots of scams are going on right now. So we have a scams to be aware of section. Our healthy aging classes will have the update on their new program. So that newsletter is only once a month. It's not something where you're going to get tons of emails from us all the time. It's once a month, just looking at the month ahead and knowing what you can sign up for. So I encourage you to do that. And how you do that is to go to our website, www.AAAWM.org. And then if you scroll to the bottom, there's this gray box you can see on the slide here. It says newsletter sign up, and you just put your email address in, and then you'll be signed up for those. Again, the next one will go out next month in March. In the interim, we also have a Facebook page. I am posting on there probably almost every day. There's obviously a lot of information out there right now on COVID and staying safe during the pandemic for older adults, vaccine information, plus all of our partners and our programming. So I encourage you also to look us up on Facebook. It's Area Agency on Aging. And then just give that page a like, and then you should be able to follow along with what we're posting there. So those are my 2 easy things.
Thank you, Emily. And I just want to reiterate, in case people popped in late, that this is being recorded, this webinar right now, and we will send out a link to that in the newsletter. So if that's something you're interested in, great reason to sign up for the newsletter. Otherwise, it might be on our website, or we can get it to you as well. So thank you to all of our presenters. That is everything. I just wanted to take a moment to go over some of the questions in the chat. Some of them have been answered already, so that's great. I just want to see if there were any that were not. So I'm going to start with Linda from RSVP. She said, sometimes our drivers call us with a concern for clients. Who do we call for a wellness check? We have 3 counties, Mecosta, Lake, and Osceola. It's always confusing to know who to call. And I believe you asked that question during Ann Ellermant's presentation on the COVID-19 fund. So Anne, if you want to speak on that.
Sure, each of those counties has a commission on aging, and I would contact them directly. You could either Google it, or else if you call our information and assistance department, they can give you the phone number. But they're the focal points in each of those communities, and they would be able to tell you the services they have and how you can connect them with older adults and their staff.
All right, thank you. Dorothy T did ask, are these services for Kent County only? And I think that was in or for Kendrick's presentation on transportation. And he said RideLink is for Kent County only, but there are other transportation services for the counties that we serve. So you can give us a call and we can give you more information if you're looking for a specific ride or a specific service as it pertains to that. And that's what Kendrick responded as well. So I did get a message just to me, so you guys might not have seen it, but somebody asked if I could go over Meals on Wheels. And I'll just say we partner with Meals on Wheels, but that does not come out of our building. So if you are looking to sign up for that, it's something we could help with, but again, it's not our agency providing this. So I would direct you to Meals on Wheels of Western Michigan. That's another agency that a lot of counties kind of have their own version of that. Sometimes it's called Meals on Wheels, sometimes it comes out of another building or program. We can help you with that as well, but just to clarify, that doesn't come from our building specifically. So somebody asked, will the PowerPoint be available? I believe the PowerPoint was sent out in an email, so I would encourage you, if you wanted to review this, to go back and check your email and find it there. If for some reason you did not get it, feel free to email me directly, and I'll put my email in the chat, but it's just carlyw@AAAWM.org, and I'll be sure that that gets to you too if that's something that you would like to review. Are these offered online? Lois asked. I believe that was about healthy aging, and right now they are being held online. Jillian, I see you're still on if you want to talk about online healthy aging classes.
Sure, that's a good question because I didn't touch it when I did my presentation. So all of our classes are currently being held virtually via Zoom. Same classes as that was on the PowerPoint are being offered. I will, Carly, on the PowerPoint, is there Eaglecrest Healthy Aging's email?
Let me go back and check quick.
I'm sorry.
No, it was not on the slide.
Okay. If there's, just look in the chat. I'm going to put our email in here right now because if you have any questions on our website at AAAWM.org, you can click on Healthy Aging, and in there has a calendar of all of our classes with the times, but everything is done virtually. Yes. Thank you for asking.
Thank you, Jillian. Next question in the chat is, with the Medicaid waiver program, is the individual able to partake in outpatient therapy services, or are they limited to in-home therapy services at that point? And I'll point that back to Stephanie since she presented on this program.
Yep, sounds good. And I am having some internet difficulty, so I'm now on my phone. So hopefully this is going okay. But yeah, so with My Choice Medicaid waiver, there was a slide that was on the PowerPoint presentation that showed the different services that we can provide. This does not conflict with or cancel out any other services that could be occurring with that individual at the same time. So in your question of, could somebody have occupational therapy, even physical therapy services? Yes, absolutely. We also work a lot with individuals who are receiving hospice care, or they have in-home physical therapy, occupational therapy, skilled nursing. That is not a conflict. It's not a pick one or the other. But what we do in those scenarios is we would collaborate with any other involved entity to just get an understanding of what they're doing, what we're doing. We don't want to duplicate any services that are being provided, especially when insurance is already paying for a therapy piece. So we're really looking at some of what's considered the non-skilled, the personal care, the housekeeping, maybe transportation to and from appointments. But yes, people can have other services in place at the same time as waiver. And at that point, then our care managers are responsible for collaborating with any other involved entity to make sure that we all understand who's doing what and nobody's duplicating any types of services.
Thank you, Stephanie. Next question is from Jay. Just the letter J, might stand for something else. I understand there is a cost share document to complete to determine eligibility and percentage for the millage services. How many other documents are required to determine income thresholds? Wondering if that one document will serve most needs. And I'll give that one back to you again too.
Thank you, Carly. So regarding the cost share, some services have different types of requirements. In some cases, it could be just contributing towards the cost of a piece of equipment or home renovation, something like that. So your best bet really would be to connect with the agency who's providing that millage service and ask them specifically what the cost share requirements might be. We do have a document that talks about it in general, and we can make that available. If it's not on our website, we can put it on our website in the millage section. Cost share is something that is not looked at until someone is at 200% of poverty income, poverty level, and then you have a certain amount you pay towards the cost of the service depending on where your income falls. So to answer it, yes, there is a general document that talks about it. We can make that available for you, but definitely for the specific millage service that you're interested in, you would want to talk to them about what their specific cost share is.
Thank you, Anne. He did ask another, or he or she did ask another question. Do many of your services have separate forms to complete regarding finances? And Kia, if you want to speak on that from an intake perspective.
We don't fill out the forms at our level. I mean, we're pre-screening to see if you will go on a waiting list for example, for the Kent County Senior Millage Services. And so that is where we would ask about if you would qualify, if you're under the asset limit. And then get into, right, your income as far as what a cost share would be, for example, for 2 hours of homemaking or for 4 hours of homemaking a week. So yeah, we would get into those specifics at the intake level. And then as Stephanie stated earlier, there is always a waiting list. So you would know that up front before going on the waiting list. And then again, when you get to the top, we would review all of that, review any changes in your finances, reviewing that you're still okay, that you would share some of the costs for the services. And of course, people could have had a change that would lower that or increase that. So we would go over that. And then the final kind of, you know, before you're fully signed up would be the care manager sports coordinator reviewing that with you. So you would know what you're, you know, paying for and what the costs include.
And can I add to that too?
Mm-hmm.
All right, so hi, it's Stephanie again. So one question I've gotten a lot just from individuals is if I'm interested in any of your programs, what do I need to fill out? What kind of forms are there? And so to echo what Kia was saying is at any time that somebody is calling our main information and assistance intake department, we're gathering that information via telephone, but there's not anything to fill out. You don't need to go on our website and find an application for any of these types of programs because that's all information that we gather. When somebody actually then is assessed for a program, there is paperwork involved, but a lot of that is what you would find with kind of anything else, a consent form, of release documents, things like that. But and especially with My Choice Medicaid waiver, if somebody needs help applying for Medicaid itself, of course, there's paperwork involved in that. But as far as what somebody needs to prepare for, it's just a phone call. And then what needs to happen once they're in a program, that's all paperwork that's just required on our end. And we would just facilitate that directly with them. So there's never anything that anybody contacting us needs to prepare for or have ready, because that's the information that we're going to be gathering. And then when it comes time to do the assessment, it's really our paperwork that we send along. So I just wanted to mention that because I've gotten that question before of people thinking that there was a lot to put together, and there's not. We just want the calls so that we can start having the conversation, then hopefully get people connected to the services they need.
Thank you. Thank you both. And Stephanie, this next question might be a good one for you as well. Oh, now I missed it. It was a direct message to me, so you might not have seen it, but is there a go-to resource to refer undocumented seniors who need case management assistance?
I have, I haven't had as much direct involvement. The agency that's coming to mind for me is Samaritas because they have a refugee program, but I don't know the full details of that program and what the requirements are for those that are undocumented. I also am kind of thinking senior neighbors in my head. If somebody is in Kent County and they're over 60, because I know they do have some case management type of services that they offer. I will say that's not necessarily my area of expertise, but that would be the things that come to mind initially for me, just if they're needing general assistance. Now, if there's different services or care needs, or again, navigating through the system, still could be worth a call to our agency as well. But those were just some additional resources that came to mind.
Carly, can I touch on that real quick?
Absolutely.
Senior Neighbors does have an elder refugee grant that they work with through the state of Michigan. So I would contact them. They do have services for undocumented seniors and working with seniors who are refugees coming to the United States. So if they were not able to directly help you, they would be able to put you in touch with either Samaritas or other refugee services that they work with throughout the region for that situation. So Senior Neighbors is one of our partners. Their information is on our website, or if you contact our agency, they'd be able to put you in touch with them as well.
Thank you, Kendrick. Those are all the questions we have in the chat right now. I want to start by asking if any of our presenters got direct messages of questions that they wanted to share that maybe other people had and didn't ask, or if not, then open it up if there are any other questions at all from anyone. No other questions? Okay, well, that is good. Like I said, this presentation is recording, so we will make that available. The PowerPoint was sent out in an email along with some handouts, just reiterating some things that people may have missed if they came in late. I am going to put my email address in the chat, and if anybody has questions regarding this presentation or anything we talked about today, feel free to email me. You can also, sorry, caps lock was on. You can also, of course, call our main number and our information assistants. They know what seems like everything. So feel free to give them a call and ask about anything that was presented on today, or if you have, like I mentioned, a specific situation that you want to run through. We do focus on making person-centered care, so we want to know the situation and give them specific care for that. So no other questions coming through, so we will wrap up early. Thank you all so much for being here and learning more about what we do. I know it's a lot of information, so we hope that this was helpful. Oh, almost forgot. There is a survey link I'm going to send out. I knew I was gonna forget that. So I'm gonna put that in the chat. It's just gonna be a link to a Survey Monkey. It's only, I think, 5 questions long, and the last one is just submitting if you have any questions that you didn't get answered. So please fill that out. It helps us kind of know how we did and then how we can improve for future presentations. And then one last thing, somebody commented that Bethany Christian Services has the Healing Center program as well. And I think that is in regards to refugees. So another resource. Kendrick is nodding. Okay, well, thank you everybody and have a great rest of your day.
Thank you, Carly.